Welcome, everyone, to the Global 360 podcast. This is the podcast for the Washington Diplomat. I'm your host, Eric Ham, and we certainly thank all of you for joining us. And we have a very special show for you today. And I'm so excited about this topic because not only is it timely, but we are doing what oftentimes in the policy world, particularly in the United States, we don't always get to do. And that is dig deep into the issues impacting policy right here in our own backyard. And today we're talking about Latin America. And I'm so excited for my guest, Dr. Lior Baruch. He is a medical executive with Cigna. He has been with them since 2012. But more importantly, he has spent nearly 30 years, more than 30 years, I should say, in Latin America, specifically Brazil. And he is going to walk us through so many of the issues that are confronting the healthcare challenges, not only of Latin America, but throughout the many different nations that make up Latin America. Oftentimes, when we talk about Latin America, and even when we talk about Latin American people here in the United States, unfortunately, we talk about them as a monolith. However, that is not always the case. And so I am so glad to have you with us, Dr. Baruch, to break all of this down and to speak to us about the issue of healthcare, but more importantly, what we are seeing as the COVID pandemic continues to plague all of Latin America, which is right in our backyard. So let's get started. Let's focus on what's happening at the 30,000 foot level. Right now, we know that COVID is still very much a hot spot in Latin America. In fact, Brazil leads Latin America with the most cases. It ranks third in the number in terms of all of nations with the number of COVID deaths and cases. And we know that there are 5 other Latin American countries that round out the top 20. So walk us through healthcare delivery at the 30,000 foot level, but also take us through some of the social, political, and economic issues that might complicate healthcare delivery throughout the region.
Thank you, Eric. My pleasure actually to be here, and I'll try to share some of the ideas, maybe by exchanging those ideas. We raise the bar, everybody is focused on the same thing, and we can exchange some ideas. So as you said, and I couldn't agree more, Latin America, unfortunately, is in a dire situation, right? It is confronting 3 overlapping crises at the same time. There's the coronavirus pandemic, there's a steep economic contraction, and there's high level of political polarization, call it that way, right? And if you look at it from a vaccination perspective, from the latest data that we saw as of yesterday, only 1 people in 10 are actually fully vaccinated in Latin America. So when we think about looking into the end of the pandemic, when this is going to happen, it's quite frightening to hear that we are on a low step walking or very, very, how shall I say this, walking very slowly towards fully vaccinating the entire population in Latin America. Now, there is an amazing positive initiative, COVAX, right? COVAX is part of the Access to COVID-19 Tools Accelerator. It's actually a framework for global collaboration that was set in response to a call back in the days in 2020, March 2020, for the G20 leaders. And then it was, subsequently launched by the World Health Organization, the European Commission, the Gates Family Foundation, and so on and so forth. And the initial goal was to actually, and it still is, to procure and to distribute, and I will say the word fairly, the equivalent of 2 billion doses of vaccines, COVID-19 vaccines, across almost 200 countries and economies by the end of this year, by the end of 2021, but throughout this mechanism. And that should actually be enough to protect high risk and vulnerable people, as well as, we have the frontline workers and so on and so forth. But most importantly, it's to ensure that roughly 90 to 95 of those middle and lower income countries that cannot fully afford to pay for COVID-19 vaccines themselves get equal access to them. That will help us fighting the pandemic and ending it. But let's remember that out of those 90 countries, of middle and lower income, several of them are in Latin America. So it is actually an interesting and important mechanism to help us out to get out of it. Now, if you remember, right, in medicine back in the days, Sigmund Freud said, the deepest essence of the human nature consists of self-preservation. We are the only species, actually, that thinks about self-preservation, and our only predator is actually our own human being again. Now, speaking of Latin America and how did we get here so far, let's speak economically. Now, we have economically, according to, let's start with the World Bank. According to the last estimate, 53 million of Latin Americans saw their income fall below the region's poverty line. If we think about the $5.50 poverty line per day in 2020 as a poverty line in Latin America, that means that almost 38% of the population is living in poverty in Latin America. The GDP has contracted by 9% in 2020, and it has eliminated most of the progress that was made during the commodity boom between 2003 and 2013. If you remember Brazil was the country that has benefited very well from an economic reform plus the commodity boom back in the 2000s, and we have gotten more than 40 million people added to middle class. Now, as a consequence of all of those, governments across the region are struggling with serious and very serious fiscal limitations, and they are unable to deliver on their very basic responses to population needs. Let's remember that we have lots of public funded and public healthcare schemes down there, and it has impacted not only prior to the pandemic, but throughout the pandemic. Now, there is a chronic underinvestment in public healthcare in the region. And then if you think between 2014 to 2019, commodities prices also shrunk, meaning it led to a GDP reduction as a consequence, right? So if you add both factors, it limited Latin America's ability to tackle the pandemic, right? As well as if you think about governments putting out some emergency cash allowances to society or the people that are in the poorest condition, that was limited as well. If we get into some of the countries later and we see how informal working is, people had to stay home in order to avoid the pandemic, but also they had to put food on their plate. So it is a very dire situation. Now, from a social perspective, and a social turmoil actually stemmed from people getting frustrating with low quality public services. There's chronic social economic inequality in Latin America, and if you had to define Latin America in one word, that would be inequality. And then you have the detached political elites. So, as I said, many people who actually joined the Latin America's new middle class during the commodity boom of the 2000s, those guys came back into poverty during the 2010. And then they're facing or realizing that, they and their children by now are unlikely to escape poverty for the years to come. So it is very frustrating. And then you get popular demands for economic justice. You get demand for support, and that got more intense and more difficult for governments to satisfy. And then it creates opening, if you look at it, and that opening for the political side. So it brings opposition and establishment against establishment figures to come to power. Think about what happened in Brazil, where left wing was in power for probably 16 years, and then we have a far right president, or what is happening in El Salvador, for instance, right? Speaking of political, Mexico, right? So, they already have a strong executive, and then the president is bringing more and more power to that executive. In Nicaragua, for example, the president has set some new laws to literally pinpoint and name traitors, and then they're putting pressure on the media who might oppose his grip on power, and then they suddenly turn into a difficult situation.
Dr. Baruch, sorry to cut you off, but I want to now kind of turn this to you. Thanks for giving us this 30,000 foot view of everything. But now I want to dig down because you're a doctor. You have actually practiced medicine. You have seen some of the challenges up front in many Latin American countries. Let's talk about what we're seeing on the ground right now. And let's use Brazil as the test case. We do know that right now, Brazil has the third most cases of COVID-19 of all major countries in the world. We know that 5 of the Latin American countries round out the top 20. So talk to us about what's actually happening and how these challenges, social, political, economic, might play into the exacerbation in terms of the continued inadequate healthcare delivery and how that could continue to plague Latin America, but Brazil in particular.
Right. So, and you're absolutely right, Eric. Brazil, although has the third global number in cases, we are actually the second in number of casualties. More than 500,000 people have unfortunately deceased of COVID in Brazil. And it is estimated that 1 out of 400 casualties that happen in Brazil is because of COVID. Now, to your specific question, there's a big dichotomy between public and private healthcare delivery in the region. Public schemes are underfunded. They provide a perception of an unreliable scheme. To those who have to rely on it, they're actually in disbelief from the get-go. And this is actually bringing access to private healthcare. That means an essential desire. And it even sometimes having access to private healthcare brings it's a status role player, right? Now, ironically, the pandemic was able to demonstrate the safety net of the component of safety net that the public healthcare brings. Now, perhaps even the opportunity to demonstrate how valuable it is, with lots of room for improvement, definitely, such as more funds, better management, private-public partnership ability to solve for specific needs. If we think about Brazil, only 25% of the population has access to private healthcare. That means that the remainder, of the 200 and total million people living in Brazil, more than 160 million rely on an unreliable system. However, when the pandemic sparked fear and desperation, people started to see the need to, go to the hospital, stay in ICU, and unfortunately have some sort of treatment. Those same unreliable facilities were the only ones available to offer a safe harbor to those in dreadful feelings, right? And if we think about the private-public partnerships, campaign hospitals, similar to those military ones built in a battle, were lifted up. We saw several private organizations, including those healthcare private rivals, have organized a consortium to sponsor the offering of more hospital beds to the public sector, which actually goes in line with a great Portuguese quote, always rivals, never enemies. Unfortunately, we have to highlight corruption as a strong embedded issue in the region. And it has charged a very big toll historically on how things are delivered and perceived in the region.
So let's talk about, because we had a conference about a month or two ago where we talked about some of the cutting edge technologies that we're seeing take place throughout the world. And of course, a lot of them are taking place in industrialized nations. But also, I want to get your perspective on, are we seeing any type of cutting edge technologies being administered or created in Latin American nations? And if so, where? And how might we highlight that? And also, what might they do to actually serve as a bulwark against some of the inadequate healthcare delivery that we continue to see plague the region?
I think that the key word here is telemedicine. The biggest legacy that the pandemic will leave us will be telemedicine and telehealth in general. Before the pandemic, or really by a little bit more than a year ago, telemedicine and telehealth was a forbidden service inside Brazil, call it that way. So no one could have any sort of telehealth delivered, services delivered throughout it, because it was forbidden by the Federal Medical Council. Now, people started to have to stay at home. It got very practical, it got very simple, it got affordable, and it got predictable. So it makes sense to deliver telehealth. So those cutting edge technologies and items are actually surrounding supplemental services to traditional medicine throughout telehealth. So calling your primary care physician, getting an advice, shall I go to the emergency room, shall I not go to the emergency room, and so on and so forth. Those are delivered consistently throughout the region as of now. And if we see it, several countries actually are seeing a spike in access to their cell phone and internet access. So what used to be very difficult a few years ago, and you used to have 2G, 3G connections, now we're thinking about LTEs and 5G connections. And the easier that we make those connections to people, that's actually easier access for them throughout telehealth. Now, the constraint is actually how to deliver telehealth to a population in general, and not only throughout private payers. So you got to have access equally, and not only in the private sector. To give you a few examples, in Chile, where we have a very peculiar and interesting healthcare system, we have FONASA, we have the public scheme, and then we have the ISAPRES, which are health promoting companies that are the private sector. Over there, telehealth was actually utilized in order to make a triage to patients. So you pick up your phone, you call, and then you provide your symptoms, and the doc on the other line might provide you a high-level diagnosis saying, no, actually, you don't need to see an orthopedist, you should go to an endocrinologist, and so on and so forth. I'm utilizing a very exacerbated example, but that's how it works. In Brazil, for instance, now it's our turn as physicians to deliver more with simpler tools. So if I need to see my patient and if I need to speak with my patient throughout a video conference, now it is legal. Now I can provide a report of the services that were done, and I can do a follow-up of the services, or even render services anywhere, right? Think about you, Eric, perhaps traveling around the world, but you are an established patient of mine. And then you just landed in Bangkok and you're feeling kind of a dizzy headache. You don't know if it's jet lag. You don't know if it's something else. You call your doctor and say, hey, doc, this is what I'm feeling. I have your records. I know how to recognize you as my patient. And I would probably understand with you throughout a few questions by looking into your body language, by speaking with you and listening to the tone of your voice. I would probably be able or in a position to make you a recommendation. Hey, Eric, I strongly believe that you should go to the ER as soon as possible, or I don't know, just take a pill, get some rest, hydrate yourself. It's going to be gone by tomorrow.
And so let's look at, because you brought something up that I found very provocative, and I think it's something our audience will certainly also think provocative. And I want you to kind of go into detail about it. You said that there's a way for Latin America to benefit from this clash of titans, the United States and China, and this ongoing economic battle that's taking place between the two largest economies in the world. There's a way for Latin America to benefit. Can you expound on that? How can Latin America benefit from that? But also talk not just about Latin America, but how some specific countries also could benefit from this ongoing clash between these two powers.
Absolutely. So I am part of a generation that saw a phrase saying, "Make America great again." I am living in America. It is a great country. And to me, when my family decided to move over, it was already a great country. So I don't think we had to make America great again. America was great enough. Hopefully it's going to stay great and greater. Now, to your specific question, China's transformation into a major consumption market for Latin America products has made this trend more apparent as countries have begun to compete to place their exports there, right? So China, as of now, is the main export for destinations such as Brazil, Chile, Peru, Venezuela, and Uruguay. And it is the second destination for Argentina and Colombia. Now, if we think about the regional commerce that used to exist, the bilateral dialogue between Argentina and Brazil, as of today, is at its lowest point, in part because of the ideological distance between the right-wing president of Brazil and the left-wing coalition led by the president in Argentina, but also because there's a lack of consensus about the need to eliminate the many exceptions that continue to dominate into the previously formed Mercosur free trade. Now, honestly, there's no central regulatory body for Latin America. Like, in Europe, we have Brussels, and there are no regional trade hubs in terms of network centrality. So think of China in Asia, think of Germany in Europe. Instead, there's a myriad of multiple arrangements with different clusters exhibiting mixed results. So Central America, together with Mexico, is more open and closely linked to trade dynamics with the United States. Mexico and Brazil, the two largest countries, are not central to Latin America trade network. And the role they play as regional hubs remain limited to their closer neighbors. And then we have the tariffs, right? Tariff and non-tariff barriers are especially high among countries on the Atlantic Ocean.
And so we've got this ongoing battle between the United States and China. There's a possibility, or there's a window for Latin America to benefit. But also, let's look at some of these variables that also could impact at least the near-term future of Latin America and many of its nations. And that is, we are now heading obviously into hurricane season. You've got a Delta variant that many expects that it will be the dominant strain in the United States, probably more so in countries like Brazil. So you have all of this that could certainly only exacerbate the problems in Latin America and the country specifically. Talk to us about how you see that playing out, but also are there opportunities? And then more importantly, what should the United States be doing as it looks at many of these nations that are in its own backyard that are continuing to struggle with the pandemic?
As you said very well, Eric, even in the UK, the current strain that is the dominant is actually Delta, right? They're seeing all their casualties driven by Delta. We saw an interesting article coming from Israel, the country that was expected to get herd immunity late as a first country, saying that Pfizer's ability or effectiveness throughout their vaccine has actually dropped from 90-something% when the Alpha variant started back in 2020 to 67% when the Delta variant started to play around. Now, let's go to the basics of vaccination. We, scientists, doctors, and healthcare professionals, never promised that a vaccine would turn anyone immune or would not acquire COVID, right? The vaccine is actually to make sure that one does not get into the severe condition. And unfortunately, there is no, and I say unfortunately because it is unfortunate, losing a single life is unacceptable, but there is no 100% effective vaccine. So even people with double or even triple. We don't know if we're going to need a booster. Only time will tell us. But those among the people that are fully vaccinated, unfortunately, we will see some casualties. There is no way to predict it. However, one thing is interesting because if we remember the plague that we had back in 1920s, that virus actually started to mutate as well. So a virus that mutates not only is a consequence of it as a component, but actually is a way out of the pandemic. So it will turn into a self-destruction mode eventually, and together with the vaccination, we're going to probably be able to get out of it. Now, what actually the US can do to help our backyard countries, I think that I saw an interesting post mentioning that America is actually donating access of its vaccines to countries that cannot afford. That is literally being empathetic and understanding that we are only going to be out of this together as human beings. And it doesn't matter if you have more money and I have less money, but now is it time for us to shake hands, hopefully sanitize or wearing gloves by now because we have to social distance yet a little bit, but we have to help each other. There's no way out of it with America being fully vaccinated and then other countries struggling with it throughout the years. Another thing to raise, which is very important, and the World Health Organization has done a tremendous, very positive job, is about trying to destroy some myths, and they call it literally a myth buster. So propagating fake news, and they call it literally the infodemic. It's not only a pandemic, but it's an infodemic. So people spreading out information that is more hazardous and bringing people to a wrong side rather than trying to help us as all humans getting out of the pandemic. So no, if you eat very hot peppers, it will not turn you immune and it will not cure you from COVID. Most likely you gotta get a burn in your gastrointestinal tract. No, getting an extremely hot bath will not cure you from COVID. You will probably get burns on your skin. And no, getting a vaccine will not inject a 5G microchip for the government to make surveillance on you forever. It just cannot comport a microchip on its structure. So it is our job as healthcare professionals to utilize as simple and as lay terms to bring more and more people closer to us so they gain confidence and they don't embrace the anti-vax movement, because it all started, step by step, and then it turns into an urban myth, and then when you lose track of it, it just turns into a snowball. So we got to help each other here to get out of it.
We certainly thank you, Dr. Lior Baruch, for all of your wisdom, all of your insight. Certainly, what's going on in Latin America, and it's interesting because Latin America is in the backyard of the United States, but unfortunately, not only does it not get the attention that it deserves, even after we have seen the vice president travel to the region, but even when the president announced the 500 million vaccinations that would be donated across the globe, we still did not see a large aggressive push into Latin America. We saw them going to countries in Asia and Africa, but we still have not seen a much more detailed plan to confront what's happening on the ground right here in our own hemisphere. But we certainly thank you for the opportunity to speak with our audience today about these challenges. We really appreciate it. Dr. Lior Baruch, he is a senior executive with Cigna. He has spent nearly more than 3 decades in Latin America, specifically in Brazil. Thank you so much for your time. Thank you all for watching and taking time out to join us for this podcast. Also, be sure to visit our website to learn more about the Global 360 podcast and what's coming up next.
Thank you, Eric. It was a pleasure.
You bet.